Welcome to MedMadness, the podcast that simplifies complex medical topics to help you ace your USMLE Step 2 CK. In today's episode, we'll dive into the ethics of accepting patient gifts and managing conflicts of interest, or COI, in industry-funded research. Understanding these ethical principles is crucial for medical students and future physicians because they directly impact patient care, trust, and the integrity of medical research. By the end of this podcast, you will be equipped with the knowledge to navigate these situations professionally and ethically. Here's what we'll cover today. Key considerations in accepting or declining patient gifts, appropriate responses to patient gifts, sources of conflict of interest in research, measures to mitigate COI, and a real-life case study illustrating these concepts. Next, let's discuss key considerations in accepting or declining patient gifts. Physicians often face complex decisions when offered gifts by patients. Several factors must be considered. First, the nature, monetary value, and timing of the gift. High-value gifts should generally be declined to prevent any potential influence on the physician's behavior. Even low-value gifts, such as cookies, require careful consideration of the patient's motivation. Second, the longevity of the physician-patient relationship. The impact of gift acceptance can vary based on how long the physician-patient relationship has lasted. Third, the patient's motivation and expectations. Gifts given with the expectation of preferential treatment or to influence medical decisions should always be declined. Ethical principles such as beneficence, justice, non-maleficence, and autonomy take precedence over the patient's feelings. And fourth, the potential impact on the physician-patient relationship. Declining a gift should be done politely to avoid hurt feelings or a sense of rejection. The physician should assure the patient that their standard of care will remain unaffected. So, when faced with a gift from a patient, the most ethical response is to express appreciation for the gesture, politely decline the gift, and assure the patient that the standard of care will remain unchanged. Next, let's explore managing conflict of interest, or COI, in industry-funded research. Conflict of interest in research can arise from financial relationships with industry sponsors, such as consulting or speaking fees, and stock ownership. Additionally, industry personnel conducting data analysis or authoring manuscripts can create biases. Measures to mitigate COI include independent trial oversight, where an independent committee should regularly review research protocols and trial data to ensure there are no conflicts of interest. Independent trial design is also crucial, where trial protocols should be designed by an independent entity, not the industry sponsor. COI disclosure is important as well. Any financial interests of study authors should be fully disclosed in the publication. IRB review is necessary. Institutional review boards must review research protocols posing risks to participants to ensure protection of rights and welfare. Lastly, secure data transmission is essential. Confidential patient data must be transmitted securely, typically in a de-identified form. Now, let's consider a case study. Dr. Smith has been treating Mr. Jones for chronic back pain for several years. Recently, Mr. Jones brought in homemade cookies as a thank you gift. Although the gift was of low monetary value, Dr. Smith was concerned about Mr. Jones's intentions, as he had previously requested narcotic prescriptions, which are not typically part of his treatment plan. Dr. Smith expressed appreciation for the cookies, but politely declined, reassuring Mr. Jones that his care would remain the same. This approach maintained the integrity of their professional relationship and upheld ethical standards. In a different scenario, Dr. Green, who is conducting a clinical trial funded by a pharmaceutical company, ensures that all trial protocols are designed independently and regularly reviewed by an unbiased committee. Dr. Green also discloses all financial ties with the sponsor in the research publication, maintaining transparency and trust in the research process. To wrap up, today we discussed the ethical considerations in accepting patient gifts and managing conflicts of interest in industry-funded research. Remember the importance of maintaining professional boundaries and transparency to preserve trust and integrity in patient care and research. We encourage you to engage with the pre- and post-podcast quizzes and utilize the Anki flashcards for an effective study session. These tools will help reinforce what you've learned and prepare you for the USMLE Step 2 CK. Thank you for listening to MedMadness. Stay ethical and keep learning. For more lifelike voices, higher character limits, and dubbing content in other languages, head to https://11labs.io !UTM_source =11labs_GPT.